and welcome to In Focus. From its humble beginnings as a private congregational prep school to now being recognized as a leading research university, Wichita State is full of amazing history, students, faculty, staff members, and researchers. In Focus hopes to bring a few of these stories to light. For this episode, we'll highlight the College of Health Professions. Recognized for excellence in applied learning and community engagement activities, the college is a primary supplier of a ready workforce in a variety of healthcare disciplines. First, we'll visit the Applied Learning Center, where students in the School of Nursing receive hands-on experience with state-of-the-art simulation mannequins to prepare them for the real deal. Let's check it out.
The Applied Learning Center is a place that students of really all health professions can come and practice before they go out and take care of patients. So we're in the simulation side of the Applied Learning Center. So these simulators behind me, they can really do anything, almost anything a human can do. They talk, breathe, heart, lung sounds. You can start an IV, get blood returns. The one sitting right behind me delivers a baby. So we can almost simulate about anything that a student will see out in clinical.
Well, we're your nurses today. And we're just coming to assess you this morning. I know you had hip surgery late last night. Can you go ahead and tell me your full name and date of birth?
So when they go into a clinical setting with a real patient, you don't want that to be the first time that they've taken a blood pressure or started an IV and done some of those invasive procedures that go along with their job duties. And here, if they make the wrong decision, if they select the wrong drug or take a wrong action as far as helping that patient, we didn't harm a real person. So they can get that under their belt, and in their thought processes when they have to do critical thinking and clinical decision making at the bedside in a real clinical situation.
I think we're all very protective of our mannequin family. I fixed Victoria's hair before we, are going to film here, and I don't know if you heard, but I talked to her. And if you see us moving them around or doing with no students in here, we actually talk to them.
Are you feeling okay?
Yeah.
Yes? Okay. Okay, so I'm just going to set this right underneath you. It might be a little bit uncomfortable at first.
If you go into the mode that you're pretending, then it's like a play, and that's, like they're playing, and we don't want them to think that. This is a real person, this is what you would do, this is how you would act. We want them to play that scenario out from the beginning to the end. And we're looking for that. And as we're debriefing, which is the time where we bring them back and out of the scenario and we debrief. Actually, debriefing is where the learning happens, where you sit and you talk about what went well, what didn't go well, how could we have improved, what others saw, how you felt. Those, we know in research that that's actually where the learning happens.
Good morning. How are you, Mr. Coffey?
I'm pretty good. I'm pretty tired still.
Pretty tired?
So again, it's kind of like riding that bike. Once you've done it over and over, it becomes second-hand habit, and when you think about now, how did I get from point A to point B? It's just part of what you do, and you go through that. So that's what simulation can help us get to as they go from novice to a semi-expert by the time they finish our program. So here you can get it wrong and it's okay. We can reflect on that and then integrate that into your knowledge base that you can apply when you're in real live situations.
According to a recent national study, simulation in lieu of treating real-life patients was actually found to be just as effective, if not more effective, in the nursing education process. On July 1st, 2018, what was known as the Wichita Area Technical College for 52 years became WSU Tech in the WSU campus of Applied Sciences and Technology. This new affiliation between WSU and WSU Tech helps both parties better fulfill their missions by increasing the availability and quality of opportunities for students. One of those opportunities came earlier this fall when WSU Tech's Dental Assistant program moved to WSU's Advanced Education and General Dentistry building. Let's see how the program is adjusting to the move and what new opportunities lay in store.
My name is Rachel Wiebe, and I'm the director of the Dental Assistant program at Wichita Tech. With the affiliation with Wichita State, there were talks about the AEGD program having empty space on their second floor, so we started entering into the conversations of possibly moving our program up there. I thought it was a fantastic idea. This summer, I officially moved into the building, and we just started our first program at the new location at the beginning of August. The AEGD program downstairs is a full functioning dental clinic. They've got great dental professionals down there. If I need a resource and a dentist opinion, I can run downstairs and ask an expert opinion on how should I approach the subject.
Number 8 was 138 over 84.
The hopes is to expand that a little bit more, and around October of the fall semester or the first semester of the program, get the students downstairs and just kind of fly on the wall in the corner and stand there and watch a procedure. You know, they just learned about a filling, now they get to see it with their own eyes, what a filling is and the interaction between the dental assistant and the dentist, which is an experience that they've never been able to do before. There's something about seeing it in real life.
CT scan, and then what we're looking at is the upper jaw.
Well, the benefit of having these dental assisting students there is that many of them want to be dental assistants. But some of them want to be dental hygienists, and even though it's a totally different approach to oral health care, the dental hygienists, we have a dental hygiene program as well, and so they have that exposure, but there are some who actually want to be dentists. And there could even be some pathways that we build from the WSU Tech programs to some of our available health programs. I know both President Bardo and President Utash talk about from GED to PhD. How do we build a pathway so people know when they start there at WSU Tech, hey, we've got this pathway for you. This may be your starting place, but guess what? We could have you go all the way up to a doctoral degree if you wanted to do that.
I hope that we can continue expanding the program with the new space. When I took over the program, our acceptance was 18 students, and there's been a greater need for dental assistants in Wichita, so we upped our acceptance to 24. Within the next year and a half or so, the hope is to expand our acceptance to 36 students a year rather than 24 and fulfilling the need in Wichita.
While WSU and WSU Tech remain separate degree-granting institutions, the formalized affiliation will allow for more collaborative possibilities as well as increased availability and quality of opportunities for students. Lastly, we'll check in with 2 communication sciences and disorders students and learn about their research with an augmentative and alternative communications device. This device helps an autistic child who is unable to use verbal speech communicate by selecting pictures on screen. Let's take a closer look.
So one of the advantages of the way that our program is set up is that the clinic can provide sort of a bridging step for the classroom to the clinic to their careers. Working with all these appropriate strategies, this particular client has not made good progress, and so we knew we needed to try something else. It's given our students an opportunity to work with a professional in the community who happens to be a device representative.
I'm a graduate student. I am now in the autism rotation at WSU. And so I'm just starting with this new client who is, he has autism and he's about 8 years old, and he uses a device for communication.
Our client has had this device for a few years now, and we've come to the realization that it's just not working for him. They're each different AAC devices, which is augmentative and alternative communication devices. The way that his brain works is he uses motor planning in order to be able to figure different things out. So this device gives him the opportunity to communicate the way you and I communicate. A new program that we're looking at that has been provided by Print Key Romic is Unity.
So if you click a category and it opens to a whole new page, we call that a hit. So his old device, it would take him quite a few hits to get where he wants to go. And so this device, it's decreased that. So it's faster for him to talk, which is really nice.
You can also customize it a lot better. And so learning how to be able to make it specific to him and his needs and his wants.
One of the challenges is the amount of money it costs to have a library of equipment. And what we've done is we've attempted to take the device that we have on loan and implement it so that we can compare his performance with this device, his use of this device, with his old one.
On his previous device, there was kind of a question about whether or not it was more him just used to that sequence. And he was just clicking, clicking, clicking until he finds whatever word it is.
So right now where we're at is we want the family to talk to the device rep and make a decision about whether or not we should try a third device.
It's trial and error, so try out different devices, different ways of communicating and see what is best for them, which is what we're doing with our client right now.
Everybody deserves a voice, and this is his way of communicating.
Not only does this research allow the students an excellent opportunity for applied learning, but they are also able to make recommendations to the client's parents for an AAC device that best fits their child's needs. That will do it for this episode of In Focus. To be notified about upcoming episodes or for other great WSU video content, make sure to subscribe to WSU TV on YouTube. Thanks again, we'll see you next time.